So, good morning, sir. My name is Robby Sangitan here in Nurse for today. And what we are going to do is that we're going to assess your genitalia and your rectum. May I ask if you can put your gown? Thank you for wearing your gown. Now, moving on to the implementation for inspecting the penis. First, let's inspect the base of the penis. Okay, pubic hair growth. Um, it is coarse and it's curly. Pubic hair is covering more area. Further enlargement of penis and testes. Okay, so no signs of any excoriation or erythema. I don't see any infestations. Okay, now let's inspect the skin of the shaft for any rashes. Okay, so here's the shaft. So as you can see, there is no hardened areas or any lesions or lumps. So it's good. I see no problems. We're going to palpate your shaft. Okay, don't feel any hardness. No hardness in the area. I don't feel any tenderness. It is good. Okay. So next is we're going to inspect for the foreskin if present, but right now I don't see any foreskin because you went through circumcision. So moving on for inspecting the glands for size. So we're gonna inspect for the glands for size, shape, and location. So for your glands, it is cone. The shape is cone shape. I don't see any redness or lesions. The location of the urinary meatus is here. It is present. Okay. Okay. So the size, it is natural size. Now we're going to palpate and squeeze the glands between the index finger and the thumb. Okay. Palpate gently. So there's a small discharge, and I think it is a normal occurrence from pre-ejaculation. Okay, as you can see here. Inspect for the size, shape, and position of the scrotum. As you can see here, the right side is bigger than the left side. So I see that the shape is oval shape. Okay. As you can see here. Okay. Yes, we're gonna observe for swelling, lumps, or bulges. So right now, I don't see any lumps. Okay. No presence of any bulges around the scrotum, and I don't see any swelling. So spreading the let's spread the scrotal folds. So as you can see, there is no any presence of lesions or rashes. So let's lift the sac. To inspect the posterior skin. Okay. Good. With the scrotal contents. Okay. It reveals testicle is ovoid. It is smooth. It is firm and mildly tender to palpation. The testicle is easily separated from the epididymis, which lies posterior and slightly lateral to the testicle. Class difference. So I don't feel any nodules or swelling. Okay. No tenderness. Let's illuminate the scrotal contents. If a mass or swelling was noted, look for a red glow. Okay. So right now, we don't see any red glow. So that means there is no mass or swelling. Okay, we're gonna inspect for inguinal and femoral hernia. So we're gonna watch for any bulges while the client bears down. Okay, inspecting. Okay. Wait for the inguinal hernia. So we're gonna start for the left side. Okay. Can you cough, please? Again. Okay, again. Okay, to the other side. On the left side. Can you cough, please? Again. Please cough so that if I could feel any bulges. Okay, the other side. Can you cough, please? Okay, so I don't feel any bulges. I'm gonna inspect and palpate for scrotal hernia. So, okay. So if a mass was detected during the inspection or palpation of the scrotum, ask the patient to lie down. Okay. Sir, could you please lie down? So we're gonna note if the bulge disappears. So if it remains, we're gonna auscultate for vowel sound. So if the bulge disappears, and if it remains, auscultate it for vowel sounds. Then we're gonna gently palpate the mass and try to push it up into the abdomen until it is too tender. So what we're going to do is that we will gently palpate the mass and try to push it up into the abdomen unless it is too tender. So na palpate it going to the abdomen. The anus and perineal, we will position the client in the same position in order to have a view for the rectal area. Okay, first we're gonna inspect for lumps and ulcers. Okay, I see no lumps. There's no ulcer lesions. I see no redness and rashes. Okay, for the sacrococcygeal area, there's no swelling, redness, no dimping, or any presence of, or there's a small presence of hair in perianal area. Okay. Now we're gonna inspect for rectal prolapse with Valsava Manuever. Okay. So, okay, there's no rectal prolapse. Now we're gonna palpate for anal sphincter tone. So, put lubricant first so that it could easily enter the anals. Okay. So we're gonna try to feel if there is a tenderness. The nodules. Okay, I don't feel any hardness. Okay, next is we're gonna palpate for the rectal mucosa if there are any irregularities or tenderness. Okay, I don't feel any nodules, any irregularities, no nodules and hardness. Okay, so palpating the peritoneal cavity for tenderness in size and shape, and the textures. Good. Okay. Now after that we're gonna inspect the feces for blood and perform occult blood tests. Evaluation. Each testicle feels firm but not hard. The surface is very smooth without any lumps or bumps. It is a spongy tube-shaped structure, which is the epididymis. Penis points to left. It is covered by hairless skin. Um, the penis is free. The penis skin is free from lesions and inflammations. The penis, the penile shaft skin is loose and wrinkled. There is no discharges from the foreskin. Okay.